Dr. Rowe here, and we're going to talk about what to expect on your first teletherapy appointment. I'm an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and make sure to turn on the notifications so you get my new videos every week. Let's dive in. So first of all, when you go to schedule your first teletherapy appointment for yourself or your child, you should expect to probably talk to an office administrator and not the therapist themselves. Some therapists actually talk to clients in advance, but most of the time, therapists really want to spend time with you, and that means you need to devote the time to them in an appointment. So expect to be able to talk to the therapist for the first time actually in an appointment. The person you talk to on the phone probably will review all the logistical information with you. What are the costs? Do they take insurance? What teletherapy platform they use? What they kind of expect? How to log into a patient portal? All that information, and should be able to answer all the basic questions that you have. For a parent, your first teletherapy appointment with your child's therapist will most likely be a parent intake, where you're going to talk about developmental history, what brought you to the appointment. And really, a lot of the appointment should be this reviewing of what brought you there, but also should be what are treatment goals, what are expectations. That's really important. You should also have a discussion about what kind of treatment methods do they use. If this is a child therapist, are they doing play therapy? I'm very much a believer in that you need to go to a therapist who specializes in whatever issue that you have. If you're an adult, that means if you have anxiety, you want to go to a therapist who specializes in anxiety. I always equate it to, would you go to get your heart checked by a foot doctor? You wouldn't. And you certainly wouldn't do a major surgery with your internist. So a generalist may be appropriate for you if you're unsure, but if you know what the issue is, you definitely want to go to somebody who specializes it. And if you're looking for a therapist for your child or your teen, absolutely only go to a licensed therapist who works with kids and teens. Kids and teens, it's a different world. Working with kids is very different. They know who loves them and who likes to have a good time. And if you're somebody who works with kids and teens, you really have to make a commitment to know what's current with kids so that you can be great at building rapport, and you have to really have fun, right? In our area, in our center, we're one of the few places that works with kids under age 5. People don't have the patience or maybe the clinical training, but kids that are under age 5, you got to get on the floor, you got to know what you're doing, and you got to have great clinical skills and have that whole mix. And also be able to work with parents who are scared, because we all know, I'm a special needs mom too, that, when something's not right with your kids, whatever it is, whether it's a neurological issue, a neurodevelopmental issue, or a situational issue, we couldn't be more worried. And so you really want to be comforted and really guided to what you actually should do. So a therapist, whether it's in person, but in teletherapy, as I always say, right, in my book, Teletherapy Toolkit for Therapists, we know that teletherapy is as effective as in person. And really one of the biggest factors in success is not just clients following through on what you ask them to do, but it's the clinical experience of the therapist is a huge factor in therapy really being effective. So my big Dr. Rowe no in teletherapy is not having privacy. You want to make sure you are setting aside what you need to make that session successful. Guess what? That means having your kids be occupied, ideally with a child care person. I know that in this time of COVID, I've had some interesting things happen in my intake sessions with parents, including the whole family show up and puppets show up, the dogs, all kinds of things. And, obviously you meet people where they're at. But in a perfect world, if you really, as a parent, want to get a lot out of your session, you got to keep your kids occupied. So call grandma, call a babysitter, do a babysitting exchange with the kids, and really devote that time to what is there. Just because somebody is in your house doesn't mean it's casual. It means that they're in your house. This is an appointment. Just like if you're working from home, you really want to devote that time so you can really get the most out of this therapy appointment, because therapy is only once a week. And when we're working with parents, the rest of the time we're coaching you on how to make those changes at home, and you can do it. My Dr. Rogo is simple logistical things. Have your paperwork done. Be ready for that appointment. Have everything in on time. Super important, so you can just jump in and get started on what needs to happen to help reduce and reverse those symptoms for your child. Come prepared with information and questions. We love questions and appointments. This is really your session, and yes, we're going to guide you, but we know you're going to have questions, and that's okay. You want to think about that in advance, and if you don't, it's a process. You'll have questions along the way, so make sure you ask. What's my biggest Dr. Roseanne go? Have realistic expectations for what therapy can do. I actually have a magic wand because the combination of the brain-based therapies and psychotherapy can be really magical, which means that it's expedited. Sometimes people have some unrealistic expectations of what therapy can do. And so it doesn't matter if you're doing a combination or you're doing straight talk therapy via teletherapy. When you're changing, change doesn't look like this. Change looks like this. And so have realistic expectations. Know that, most people are in therapy a minimum of 3 months. 6 months is way more typical, and that you have to devote time to the process and actually implement some of these changes. Often we think of change as, this big mountain. How can I really get up there? But it's those micro steps. And a great teletherapist is going to be able to help you do that in a way that's going to work for you and your family. And there's going to be times when it's uncomfortable. So realistic expectations for yourself, for your child's behavioral change or your teen's behavioral change is really important for the process. So remember, if you or a child you care about is struggling, it's going to be okay. I am here to show you how to help children and teens feel calm, alert, and good about themselves. I want to hear from therapists and parents about their teletherapy experiences. So drop it in the comments. Catch you on the next episode. And remember, subscribe to the Dr. Roseanne channel, where we talk about natural and effective ways to reverse and reduce children's mental health issues.